Today, I will be discussing a little something about diabetes. Diabetes is an endocrine disorder that results in partial or complete lack of the hormone insulin. Insulin is the hormone that controls blood glucose levels in the body. Some symptoms associated with diabetes include polydipsia, which means excessive thirst, polyuria, which means excessive urine output, and rapid weight loss. For those who have diabetes, certain dietary advice are given to prevent the disease. Nutritional therapy is a difficult but necessary dimension in the management of diabetes. There are 5 goals in nutrition therapy. First, maintenance of as near normal blood glucose levels as possible by balancing food intake with insulin oral glucose lowering medications and activity levels. Second, achievement of optimal serum lipid level. Third, provision of adequate calories for maintaining or attaining reasonable weight for adults, normal growth and development for children and adolescents. This may not be the same as the traditionally defined desirable or ideal body weight. Fourth, prevention and treatment of acute complications of diabetes mellitus, such as hypoglycemia, short-term illnesses, and exercise-related problems, and long-term complications of diabetes mellitus, such as renal failure, autonomic neuropathy, hypertension, and cardiovascular disease. Last but not the least, improvement of overall health through optimal nutrition. Calorie-controlled diets are planned by first calculating a person's energy needs and caloric requirements based on his age, gender, height, and weight. An activity element is then factored in to provide the actual number of calories required for weight maintenance. To promote a 1 to 2 pound weight loss per week, 500 to 1,000 calories are subtracted from the daily total. The calories are distributed into carbohydrates, fats, and protein, and a meal plan is then developed, taking into account the patient's lifestyle and food preferences. According to the American Dietetic Association, 50 to 60% of calories should come from carbohydrates, 20 to 30% from fat, and the remaining 10 to 20% from protein. The majority of the selection for carbohydrates should come from whole grains. Foods high in carbohydrates, such as sucrose and starches, are not totally eliminated from the diet but should be eaten in moderation because they are typically high in fat and lack vitamins, minerals, and fiber. Recommendations regarding fat content of the diabetic diet include both reducing the total percentage of calories from fat sources to less than 30% of total calories and limiting the amount of saturated fats to 10% of total calories. Additional recommendations include limiting the total intake of dietary cholesterol to less than 300 milligrams per day. This approach may help reduce risk factors such as increased serum cholesterol levels, which are associated with the development of coronary artery disease, the leading cause of death and disability among people with diabetes. The meal plan may include the use of non-animal sources of protein, examples of which are legumes and whole grains, to help reduce saturated fat and cholesterol intake. In addition, the amount of protein intake may be reduced in patients with early signs of renal disease. Fiber. Increased fiber in the diet may improve blood glucose levels, decrease the need for exogenous insulin, and lower the total cholesterol and low-density lipoprotein levels in the blood. There are 2 types of dietary fibers: soluble and insoluble fiber. Soluble fiber in foods such as legumes, oats, and some fruits play more of a role in lowering blood glucose and lipid levels than does insoluble fiber. Soluble fiber slows stomach emptying and the movement of food through the upper digestive tract. The potential glucose-lowering effect of fiber may be caused by the slower rate of glucose absorption from foods that contain soluble fiber. Insoluble fiber is found in whole grain breads and cereals and in some vegetables. This type of fiber along with soluble fiber, increases satiety, which is helpful for weight loss. At least 25 grams of fiber should be ingested daily. Index. One of the main goals of diet therapy in diabetes is to avoid sharp, rapid increase in blood glucose level after food is eaten. The term glycemic index is used to describe how much a given food increases the blood glucose level compared with an equivalent amount of glucose. The effects of use of the glycemic index on blood glucose levels and on long-term patient outcomes are still unclear, but it may be beneficial. Although more research is necessary, the following guidelines may be helpful when making dietary recommendations. First, combining starchy foods with protein-containing and fat-containing food tends to slow their absorption and lower the glycemic response. Second, in general, eating foods that are raw and whole results in a lower glycemic response than eating chopped, pureed, or cooked foods. Third, eating whole fruit instead of drinking juice decreases the glycemic response because fiber in the fruit slows down absorption. Last but not the least, adding foods with sugar to the diet may result in a lower glycemic response if these foods are eaten with foods that are more slowly absorbed. I will be naming some foods that are good for diabetic clients. Some of these are: first, oatmeal. Next, all kinds of berries. Next, green leafy vegetables such as broccoli, spinach, other vegetables such as asparagus, and carrots. Fruits, which include apple, watermelon, melon, and tomato. Fish, soy, yogurt, flaxseed, nuts, beans, and tea.